Welcome, and thank you for your interest in the Heart Function Clinic. This video was created to help family physicians navigate referrals to the Heart Function Clinic. Over the course of this video, we will review heart failure and its relevance to you and your clients, the Heart Function Clinic model of care and services, the Heart Function Clinic's 6-month patient journey and what to expect when your client is referred, criteria for referral, and finally, the referral process. The prevalence of heart failure continues to increase across Canada and worldwide. Over 750,000 Canadians are living with heart failure. 1 in 3 Canadians are affected by heart failure. The projected cost for heart failure by 2030 is greater than $2.8 billion per year. The patient could be referred to the Heart Function Clinic by the acute care physician post-presentation to the hospital for decompensated heart failure, or by the patient's primary care provider. We will now review reasons for referral and referral criteria. Reasons for referral include: your client has had a recent heart failure hospitalization, your client has recently been diagnosed with heart failure, your client is experiencing worsening heart failure symptoms, your client is not yet connected with a community cardiologist and requires immediate consultation, established heart failure of any etiology with a left ventricular ejection fraction of less than 40%, left ventricular ejection fraction greater than 40% with signs and/or symptoms of heart failure with an elevated BNP or NT-proBNP. It's recommended that a referral to a cardiologist for longitudinal care has been initiated by yourself prior to discharge from the Heart Function Clinic. We do not accept referrals for general cardiology consultation. Re-referrals will be considered if a client's condition changes. Length of stay for re-referrals is usually 2 to 3 months. Now that you have determined your client is an appropriate referral, let's review the referral process. You can find the Heart Function Clinic referral form located on Pathways and fax the completed referral form to our clinic. Our referrals are triaged within 3 to 7 days. Most clients will be seen within 2 to 6 weeks. You will receive a notification that we have received your referral with your client's appointment date and time indicated. We recommend a recent echocardiogram and labs including BNP prior to the first appointment. If unable to obtain an outpatient echocardiogram, one will be ordered through our clinic. We hope to reduce all-cause mortality, reduce heart failure hospitalizations and length of stay, improve better doses of medical therapy, improve better adherence to medicines, improve overall quality of life. To achieve these goals, the patient will be followed by a network of specialty-trained practice clinicians over approximately 6 months. Once you refer a patient, the referral will be triaged to determine urgency and booked within 2 to 6 weeks. Heart failure education is introduced at the onset to promote self-management. Heart failure introductory class and diet and nutrition classes are available for viewing online and through printed resources. We offer a multidisciplinary approach to care. Your client's journey may include support by a cardiologist, nurse practitioners, nurses, pharmacists, dietitians, social workers, and mental health support as needed. The first appointment will be with our cardiologist, nurse, and pharmacist and may include the following: comprehensive physical and symptoms assessment and determination of etiology if required, recommendations for heart failure management and stabilization, initiation and/or adjustment of heart failure medications according to Canadian heart failure guidelines, assessment for advanced therapies such as implantable cardioverter defibrillator and cardiac resynchronization therapy devices as indicated, discussions on advanced care planning and assessing the need for palliative referral, referrals to social worker and Fraser Health mental health teams to provide emotional support for clients and families, as well as referral to registered dietitians to provide dietary assessment and recommendations. Clients are seen every 2 months in person by a nurse practitioner or cardiologist. In between the 2 months, telehealth appointments are provided at regular intervals by a pharmacist or registered nurse to implement a treatment plan, assess tolerance to therapies, and adjust doses of medication as required. We attempt to up-titrate medications at regular intervals approximately every 2 to 4 weeks to achieve target doses within 3 to 6 months. After each consult visit, you will receive a heart failure consultation note that includes recommendations and plan of care, and any recent changes to therapy. Once your client is stabilized and on optimal therapy, they will be discharged back to your care. Thank you for taking the time to become familiar with the Heart Function Clinic mode of care, patient journey, and referral process. We look forward to collaborating with you in the management of your client.